Coming to the formation of the QRS and T wave. First of all, QRS is for ventricular depolarization and T wave is for ventricular repolarization. And the QT segment, that is from the beginning of the Q till the end of T, represents the complete ventricular activity. Now coming to the nomenclature, the first negative deflection after P is called Q. If it's big, then capital Q. If it's small, then small q. The first positive deflection after P is the R wave, small and big. And the subsequent negative deflection after the R wave is called S. Now coming to the genesis or formation of the QRS complex. So the ventricular depolarization is actually occurring in two parts, the septal depolarization initially and the free wall depolarization subsequently. So the initial septal depolarization starts in the lower one third of the interventricular septum, and there is a small initial leftward vector followed by a big right vector. So the net deflection is towards the right, that is the net septal depolarization vector directs towards the right, giving a small positive deflection in V1 but a small negative deflection in V6. Now coming to the free wall depolarization. After the septal depolarization, the signals go throughout the ventricles and there is a in-phase depolarization of the ventricles, as I explained earlier, that is transverse, that is a near synchronous depolarization of the whole ventricular wall. Now the left ventricular wall is bigger and thicker, right ventricle is thinner and smaller. So the net resultant vector of the free wall activation is towards the left. Therefore, there is a big positive deflection, that is R wave in V6, but a deep S wave in lead V1. Now, after the QRS complex, there is the ST segment and the T wave, which represents the ventricular repolarization, and the U wave is for late depolarization of the mid-myocardial M cells or after depolarization. Now, two very special points. The AVR lead is looking into the cavity of the heart, so all the resultant vectors are directed away from the AVR. So all negative deflections are present in AVR. So any positive points towards anomaly. Another special point is that only two vectors point towards V1. First is the initial atrial depolarization vector and the second is the resultant septal depolarization vector, which we just studied. Keep following to learn how to detect myocardial infarction and various arrhythmias and become an ECG expert yourself.